Today, Dr. Hsiao unveiled his 3 plans for healthcare reform in the state of Vermont. You were planning on going live,
right?
But you couldn't make it. So you experienced it through, you were saying...
I experienced it by listening to a live stream, and actually had to listen to it on my phone because my broadband was flaking out, so I couldn't listen to it on my PC. So I had my Droid plugged in, and then I was using my PC with my tweet deck, looking at Shay Totten and Representative Lorber and other people tweeting about it, and then looking over and seeing what people were saying on Facebook and stuff. So I had this very rich media experience that I wouldn't, I mean, it would have been maybe a better experience maybe in real life, but it was a very rich experience anyway, so I didn't feel like I missed out on much. Yeah.
Right, somewhat replicate it, and maybe even get some more with the analysis in real time.
Yep.
So content-wise, what did you learn about our options today? Did he?
Well, it was interesting actually because I've been a proponent of single payer for a long time. I actually actively fought against the Health Care Act that the Republicans are trying to repeal because I wanted more and I felt it entrenched too many of these other corporate interests. But you know, I celebrate the good things, and I just FYI. But here I've been focusing on single payer, and it was interesting to hear Dr. Hsiao say his plan that he recommends is the 3rd option that was mandated out of the S88, and it was a single payer that's administered by a public-private partnership. And I thought that was interesting because it really is a way to get more buy-in from people who might resist a purely government, oriented single payer, even though that's what like Medicare is. But it also kind of fits what some of the things we've done in Vermont, and it actually is going to save us about 8 to 12%. And I'd been always talking about 5% savings on the road, when I went out talking to people. So it actually is going to save us more money. And it was interesting thinking about it in terms of like Blue Cross Blue Shield being perhaps one of the people who might compete for that, partnership there, because I went to one of these candidate breakfasts, and they were all talking about how great they are, and I asked them a pointed question during the Q&A. What are you going to do? Single payer is inevitable. Where do you see your role? And they went, well, we could administer it, so you know that they're going to now have buy-in on that, so we have more likelihood of getting what we need because we're offering them a little bit of a hook there. So
if they would become, I guess, an administrative monopoly, but they would probably expect that their profit margin would shrink. So you've got to find those win-wins.
Exactly. Everyone needs to feel that they're going to benefit somehow, because there was a lot of focus on, well, what about these people who lose jobs? Well, we're going to create 5,000 new jobs out of this, and maybe some of those jobs will be yours. We have to think about the common good, which is in our Constitution, our Vermont Constitution, as well as what will this actually mean for you individually. So you have to balance all that, and that's what's hard to get all the buy-in. So
did he take questions, or was it a straight presentation?
He had the whole team available to take questions, and I had to bail on some of the questions then, so I don't know what some of the dynamic was, but the presentation was really good, and it seemed to get a really good reception from a lot of people. Shumlin said he liked it. I know that Jason Lorber liked it, and a few other people I saw also seemed to think it was positive. I thought it was great. It made me question some of my assumptions too. I liked how he presented it, and it made me think, yeah, you know what, I could totally go for that option that you're recommending, because I think it's got the best likelihood of success, in the short term politically. And he even brought up sausage making, which is one of my favorite things about politics, and I think it'll save us a lot in the long run and give everybody the health we need, so we can compete as a state. We really need it to create jobs and to make people able to start new businesses and whatever. And it's really good for the economy, despite some of the misinformation out there.
The state deficit too, a lot of healthcare costs with state workers. So he also presented a pure single payer system?
There's a pure single payer and a kind of a public option, and then the 3rd one was left vague in the act, which said you will come up with something that meets all these goals of universal access and blah blah blah,
and kind of is customized to fit what Vermont already has.
Yeah, I think it's a nice evolution, and I was real pleased to hear that. I wasn't sure what he was going to do with that, and I knew that his team was good. A lot of us in the community supported having him be the one who was going to lead this team, and I think they really came up with a good one. I think it was a home run.
And what a way to kick off a legislative session. I mean, now we can. I think this national spotlight starting to pay. The health insurers are definitely going to start paying attention. We'll see if the big money starts showing up in the State House. It's going to get really interesting.
Well, we got 15 days for public comment, and then it'll be some tweaking, and then we'll go to the ledge. So
I guess there's going to be a website where people can go specifically to public comment. I wish I had that.
Yeah, I don't know if it. Yeah, I looked. Before I came down here, I wanted to see if they had any info in either the Worker Center or Vermont for Public or for single payer, and they didn't seem to have anything yet. So.
So we're going to wrap it up right now.
Yep.
If you do get a chance online to go to, go to the state website and get your word in about what you think about finishing the job here in Vermont and getting everyone covered for health care. And Todd, thanks for getting the year kicked off here.
Hey, thanks for inviting me.
Blogosphere. It was a great conversation. We went all around the planet and came right back home. So good night, everyone.
Thank you very much. Appreciate it.